everybody. I'm really happy to be here today at Bumrungrad International Hospital because today we have the honor of talking to Dr. Karl Kalavantavanich, who is actually a pediatrician and pediatric allergist and pulmonologist at the hospital, so that he can advise us on some of the safety precautions that we can implement during COVID-19 when school opens.
Well, thank you for inviting me here, and it's my honor to be here to help you a little bit about the health concern issues. For my part, about the medical point of view, about the two sides, about from the patients, from the family, from the students side, and from the school. For the students, for the family, the most important thing is I think they have to keep your child healthy all the time. Okay, means that you have to be like eating good food, healthy food, stay healthy, doing some exercise, sleeping well, getting immunization. That especially for the influenza, for the flu shot. We don't have the COVID vaccine yet, but we have to, stay healthy in the way of don't put themselves at risk of any, illness or any situation that increase the risk to get infectious disease, including COVID. From the school point of view, the good part is nowadays we're talking about, this is the end of June, the incidence, the numbers of the COVID in Thailand is almost minimal. Okay, and I say that the government has done a lot of good works on that part, and so we don't really have in-country cases during the past month at all. So I think you already have those screening methods, like the temperature scanning,
hand sanitizing.
Good hand sanitizing, good hand washing with alcohol. Right? So there's a few things that's a good practice, and I think it's a good idea to keep the students get used to how to do the good hand washing to become a habit, the good habits. The other thing is going to be a little bit different from before the COVID is the distancing.
Right.
Okay, so you have to have a good distancing protocol in everywhere in the school, starting from the lineup, going in the entrance, and then in the classroom. You have to have at least about 1 to 2 meters apart, minimizing the contact, the personal contact between the students, because sometimes it's a little bit difficult. Kids, when they go together, they stay in groups,
they
play together, they get very close contact to each other. So you have to have some school policy or something or regulation that to help to minimize that. I don't know, let's say like if you want to the schedule of the classroom going to be a little bit overlapping, so they don't come out together at the same time, something like that.
So right now our lunch breaks are separated so that there's enough space for everybody to be sitting 1 meter apart. And also for playground, we also will break the children into small groups, so that within one space there's only maybe limited number of children, and then they can rotate. And then after every round of playground or lunch or anywhere that the children use, the housekeeping, the school team will be there to sanitize after every use. And obviously face masks, but our school will be requiring face shields too in the beginning.
Okay, so that's a good idea. I think it's a very good idea for that part. The most important thing is a face mask and good hand washing.
Okay. So just now you mentioned about, soon maybe influenza season will come. So is there a possibility of contracting both influenza and COVID at the same time?
Well, that's a very good question, because usually every year during the rainy season, the peak flu season in Thailand is in August, around August, September. Okay, and one of the most common germs is the influenza every year. Others, including like RSV, hand, foot, and mouth disease, they all come around the same time. So to me, this year going to be a little bit different, because in addition to whatever we have before, like flu, this year we have to be careful about the COVID-19 also. So to me, there's a chance that if you get influenza, you can have COVID together at the same time, meaning that you have increasing the COVID cases in Thailand. Okay, but at this point, at this time, I think the case is so minimum. So we aware of that, but don't over panic on that part.
So for the other like influenza, they can get a vaccine.
Yep,
right?
they can get a vaccine. It helps, about 85% of the cases. And every year, this is the time to get it, around like after Songkran anytime, for the southern strain of the influenza.
And suppose we reopen school and there is a, let's hope it doesn't happen, but if there were a confirmed case in maybe an adult or a child, we would be closing the school for at least 2 weeks. Do you think that that's sufficient time to be disinfecting and also having that, separating the infected person? Do you think that's enough time?
Well, first of all, I think we have to follow the government recommendation or regulation on that part. To me, the 2 weeks from the last contact, from the last case, index case, that's enough. Okay, so if you have only one case, and you quarantine every day, you close the school, for 2 weeks, that should be enough. Yes.
So I think our concern, but also our parents' concern is more towards younger children as well, because young children like to touch each other, and we'll try our staff will try our best to socially distance them. But what if they do come into contact with each other? But they will have a face mask or face shield on and a face shield on. Do you think we should be worried if that happens?
That's okay though. To me, I think that's the normal activities of the kids. And we already have protection gear as much as we can already. So kids has to play each other. I think that's normal. You cannot too strict for them. I mean, sometimes you can help a little bit. You can minimize something, but they have to play each other, and that's okay. We cannot separate them. Otherwise, why they have to come to school?
If they're very young, it's a little bit hard.
They can play each other, and that's all right.
Okay, and then another question is that for very young students, like 2 to 4 years old, they nap at the school. I think a question that many parents would like to know is if they should be wearing a face mask while they're sleeping, or they shouldn't.
There's two signs of that. Face mask can help to protect germs to that person. At the same time, the recommendation, especially in the young kids, they don't want to wear the face mask. That we don't recommend to wear the face mask. And the reason is because it's very difficult to breathe.
During sleeping.
During sleeping, or even sometimes while awake, sometimes it's difficult too. So to me, especially in the baby, it's very difficult. So to me, if they're sleeping, it's okay to not wearing the face mask. It's okay to do that.
And if they're not sleeping, if they're learning and playing, do you agree with maybe wearing it for maybe 2 hours and then taking it off so they can breathe properly for a little bit and then wear it again? What is your recommendation?
To me, I don't think we have to be too strict on that part.
With the very young.
Very young kids. They can wear it, they can take it off, it's coming out. You can just put it back on when you see it. It not have to be too strict on that part, because otherwise.
Also because they cannot communicate to us.
Exactly.
They cannot breathe properly.
Exactly. Yeah. Otherwise, if you become too strict for them, then they won't. It's not going to be natural. It's going to be
very forced.
Yeah. I mean, it's not the way it's supposed to be when you go to school. Kids have to play, have to laugh, have to sing, have to, So to me, if you strict too much, then they cannot do that, they cannot do this. So you let them wear masks, and that's okay. And you try. If it's come off, it's okay. You stay there, that's fine. Sleeping, take it off.
It's better to monitor their health.
Yeah,
right?
Exactly.
That they're in good health, they don't have a high temperature, they're not exhibiting symptoms.
Exactly. Yep. That's more important.
That's more important. Yes. And then the other question is about, is it more if younger children catch COVID-19, is it more dangerous for them than if an older child or an adult caught it? Nowadays, we know that the COVID-19, infected in adults
and the elderly more than in younger kids, in the babies. So to me, the incidence and the number of the kids who are going to have COVID-19 infection is much less than adults. So the chance to get infection is much less. At the same time, if they get the infection, the chance to spreading to other kids, to bigger kids or adults, is also less than adults to adults.
So in your opinion, after closure for 3 months and the children having to do online learning, can you explain the social emotional benefits that will happen when they return to school?
Well, to tell you the truth, the kids gonna love that. They want to come to see each other, their friends. They want to come back to school. I have a lot of my patients that just looking forward to the school opening, because they miss the school, they miss their friends. And but online learning is a good thing that we have that in the way of the better than nothing at all. School closed. If you don't have any online learning, then it's much worse. And online learning is good, but it's not as good as when you go back to the school. Okay, so if the kids all go back to the school, they're gonna have social, emotional, everything gonna come back like kids the way it's supposed to be. So I think it's very important, and that may be one of the first priority for kids to go to school.
So this is the next question is not really about COVID, but just sickness in general. Obviously, when children go to school, they are exposed to more germs because there's more people.
Yep.
And but I want to ask you about immunity. How does immunity develop? The immune system develop? Is it important sometimes to get sick sometimes so that the body develops a stronger immune system? Can you advise on that?
Well, kids, especially in the young age, less than 5-6 years old, when they go to school, kindergarten, they get sick quite often.
Right.
And part of that's normal, okay? And it's seasonal also. You have, as I said, that you see more during the rainy season in Thailand because there's a lot of germs. And when they get sick with a cold, with the flu, with many other viruses, the body is going to start to build their immune to that. Okay, so the more frequent that they catch a cold, the more immune they're going to be usually. Okay, so when they become bigger kids, like 6 years and above, you will see much less respiratory infection, less cold, less flu. So to me, and that's part of the immunity that the body start to produce. Okay, big kids have a higher chance to spread more than the small kids. Okay, big kids is more like adults.
Right.
Okay, so the babies or the younger kids is much less likely to spread to other people.
Okay. And I think lastly, maybe if you can advise parents to ease their worries or their fears, well, what is some advice you can give to parents?
Well, I think it's a good thing that the COVID-19 in Thailand is under control right now at this moment. So to me, if the school gonna open, which is a good news, and to me for kids, they have to go to school. You cannot close forever. So it's a good time to go back to school and enjoy kids' life. Whatever they want to play, they want to laugh, they want to sing, they want to learn, then and enjoy their life. And we do in our part in the protecting them from getting the infection by many means that we were talking. Okay, so to me, you can think about COVID, but don't worry too much about that.
So we would like to thank you very much, Dr. Karl, from the American School of Bangkok, Sukhumvit, and also the Didyasarin International Preparatory School. Thank you for your time today. We learned so much, and we're going to take your advice to implement at our school. ขอบคุณค่ะ
Thank you.
ขอบคุณค่ะ